Hello, this is Tom Bernacki, and today I am with Jonathan Gasso. He is from PARC Homecare, and today we're going to be talking about the differences between home care that insurance covers and home care that insurance does not cover. So, Jonathan, thanks for joining us today.
No, thank you. Thank you for having me.
Down to the question. Jonathan, does Medicare cover home care?
Yes. Yeah, the beauty of home care and Medicare is Medicare picks up the cost 100%. So if you are deemed homebound and meet the criteria of home care, it is 100% covered by Medicare.
Gotcha. So what about like copays? So when I go see a specialist, I have to pay like $25. Is it anything like that with home care?
No copays, no deductibles. It is covered 100% by your insurance if you have Medicare. Now, if you do have private insurance, a commercial plan, Blue Cross Blue Shield, for example, there could be, depending on the type of plan you have, but if you are a Medicare subscriber, it's covered 100%.
So Medicare does require certain things. You need to be under a doctor's supervision. That means you need a prescription for home care, and a doctor must certify that you need that care and that it's beneficial to you, and you must be reasonably homebound. What homebound means is that you have a very, very difficult time making it to the office. So if you're wheelchair bound, you're overweight, you don't have a lot of family to give you a ride, these would be reasonable justifications for not being able to make it to your doctor's office. Now, at the same time, this does not mean you're going to get 24 hours of care and somebody living in your house. This is considered intermittent care. So these are services here, but we're going to talk about this in the rest of the video. But we're talking like maybe 1, 2, or 3 visits for like 15 minutes during the day. This is not having a whole team of people living with yourself or your loved ones taking care of them. That's, I think, the biggest misconception. That's considered private duty home care. So when you say it's covered 100%, what do I, as the patient, have to do to get that coverage?
So, I mean, as long as you receive Medicare benefits and you are deemed homebound, meaning it's difficult and taxing effort for you to get out of the house, you just had a complicated surgical procedure. Geriatric patients is a very common client of ours. So if you're elderly and it's difficult because you're using assisted devices, you now fall under that guideline that you can receive home health services. So if you're a physician, a nurse practitioner does write a script for you to have home health services, it'll be covered.
Okay, great. So you do have to see your physician and you do have to get a letter. So in insurance speak, we kind of talk about something called medically necessary. So you do have to see a physician and someone has to write you a prescription, whether a nurse practitioner or a physician, that is necessary. So from that standpoint, could they just call up your company or do they need your doctor to set it up? How would you go about that?
So we've had it happen multiple ways. Some clients are referred to us directly from physicians. And then also there are clients who've heard of our services. They seem interested in it. They call us. We will prep them because a lot of times having this handled by your primary care physician, they can write you the script, or if you don't have one, we can set you up with a visiting physician to come to your house.
Please go to our website, michiganfootdoctors.com. We do have home visiting podiatrists available that can come to your house and they can help you out with a podiatrist physician visit to take care of your feet. Great. That's awesome. Yeah, so that's a great service, is if you can get a physician to come out to the house. That can make a big difference for a lot of people that are homebound, especially. That can make a big, big difference. I know companies like Jonathan's, like PARC Home Care, whenever I had patients, you can make it out to the clinic for evaluation of a wound or a surgery or a big problem like a broken bone, but it's so hard to come in once or twice a week to the clinic, but that's where home care can really come in handy. And I'll tell you, when I first started out in clinic, that's something that I didn't really understand. I was making patients come in regularly, but with home care, adherence is much higher. People don't have to go to the hospital quite as much. So I'm a big fan of what's termed skilled home care, like companies like Jonathan.
Yeah, I mean, honestly, working with podiatrists, any surgical procedures or wound care in particular, podiatrists are a really nice referral source for home care because a lot of their patients require that level of need. And it's nice to communicate with your physician Our nurses will go out and see the clients and then, provide physicians with updates of what's going on. It does seem to be a really good match.
Yeah. Now, the services Medicare covers are considered intermittent skilled nursing care. So, this could be different specialized services, but it's not considered long term care. We're talking intermittent, that means a few times a week, maybe once, twice, or maybe 3 times. Usually it's once or twice for like 15 to 30-minute visits or so. We're talking short term, that's physical therapy, occupational therapy, speech pathology, social workers, potentially durable medical equipment. So things like walkers, wheelchairs, a hospital bed if you qualify, although that is a ton of paperwork and generally it can take a long time. We're talking like 60 plus days to eventually get this thing. It can take a little while, unfortunately. They don't move that quick. But what happens is there are ways to compensate. You can hire what's considered a private duty caregiver. This is the type of 24-hour caregiver that people think about. If you have the means, this is not covered by insurance necessarily. It would be like an hourly rate where you can pre-negotiate 4-hour chunks, 8-hour chunks a couple times per week, to help you with your daily activities. Now, is it expensive? It's like $25 to $40. That's why we include a link below. In Michigan alone, we have like 7 or 8 different ways to help you pay for it. Whether Medicare, Medicaid, VA benefits, long-term care insurance, different plans, reverse mortgages. In this book, we kind of cover all these options to see what the best option is to cover your private duty home care. So click below.
So great. For the people watching, like what kind of services, I know you must have a list regularly. Now's kind of the time for like what services can people get from you and what can't they get from you?
So what is deemed a skilled service under skilled home care is nursing services, physical therapy services, occupational therapy services, speech therapy services, medical social work, dietitians, and home health aides. I think one of the things that comes up often for people that they question is long-term caregiver services. Those are not covered under Medicare. Home health aides come about an hour a week to kind of help with some of the ADLs, but not long-term caregiver services.
Gotcha. And correct me because I don't understand this as well, even though I order these all the time. I know after surgery, especially when we're in a cast or something after surgery, a home health aide can help shower, maybe help change, but that might not be something that could regularly be done. And it's for probably a limited time. Is
Correct.
That fair to say?
Yes, it's not only a limited time, but they can only be on service when there's another skilled clinician. So a home health aide cannot be on the case by themselves. They have to be supervised by either a nurse, PT, OT, etc. Again, it's not like long-term caregiver services.
Mm-hmm. Let me ask you this, because this is always important. What does an occupational therapist exactly do at the house? Like, how do you find that beneficial for people, at home that could use one?
Yeah, so speaking as an occupational therapist, I am a big advocate for my profession. Not to be mixed up with an upper body PT, which is what people think often we do, but we focus on ADLs. So oftentimes we do work on strengthening and range of motion for the upper extremities, so that can mimic physical therapy, but one of the important things that we do is we focus on how it's functional, because all your ADLs we take for granted unless we lose them, but bathing, cooking is an IADL, grooming, things like that. These are services that, we provide assistance with either re-education or we help people find adaptive ways to do new things. Mm-hmm. So as an OT, I would say one of the things we focus on is how you can live as independently as possible in your home.
Yeah. So this is a great service. I'll tell you from my standpoint as a physician, everybody can benefit from home care. So if you're in the Metro Detroit area, give a click to Jonathan's company. I will put it down in the show notes. So that's PARC Homecare. At the same time, if you are not covered by Medicare, and you need more of that long-term care, like 8 hours a day, getting drives to your physician's office so you could see your podiatrist, for example, then that would be more of a private duty home care.
Insurance company generally don't cover what's called custodial care. They cover short-term intermittent care for short durations. So it does not cover 24-hour care. It does not cover homemaker services, house cleaning, bathing, dressing, or using the bathroom. It does not cover medication reminders or rides to your doctors. This would be taken care of what's considered private duty home care. So a company like Assisting Hands, which full bias alert, I am a big fan of and part of, but Assisting Hands can help with all of this. It can help you get to the doctor's appointments. It can get you help with those 24-hour daily living tasks. So if you're in Michigan, give us a call or check out the website. Check out the ebooks we have on the rates, which are very competitive, and the different ways to pay for it.
So that's something not necessarily covered. And, companies like Assisting Hands Home Care, also in the show notes, those work well in concert with skilled home care. I know with what's called private duty caregiver, which is more cash-based caregiving, it works well because they can't do medical services, but PARC Home Care and skilled nursing companies like Jonathan's can do that type of work. So that works really well together. So if you need private duty home care or skilled home care or a podiatrist, click down in the show notes. And if you're in the Metro Detroit area, we can help you out with that.
Private duty home care is not the cheapest. It's like $25 to $40 per hour on average across Michigan. That's why we came up with a book. How can you pay for these things? At Assisting Hands Home Care, we try to provide competitive prices and open up all options because it's not cheap. Nursing homes are even more expensive. So if you don't need one quite yet, consider private duty home care as an option. And if you need anything, just call our office. But check out some of these videos, subscribe, let us know if we're doing a horrible job or a great job. We could definitely use the feedback to keep making you great videos. Thank you.